put your hands together for him? Please, can you put your hands together for him? We also have the representative of the Independent Corrupt Practices Commission, that's the ICPC. We have Mr. Tekere Yinebi. Apologies for murdering this name. I would have to come meet you to learn how to pronounce your name. Please, can you put your hands together for him? We have the representative of the Ministry of Petroleum Resources, Mr. Emmanuel Okoro. Please, can you put your hands together for him? We also have another representative from the ICPC, Mr. Agboro Michael. Please, can you put your hands together for him? One of our biggest, one of our biggest partners, Connected Development has in the country currently is Oxfam. To bring us the welcome remarks from our partners on this town hall meeting, please, can you welcome Laushi as she gives us the welcome remarks. Please, can you put your hands together for Miriam as she comes forward? Please don't stop clapping until she gets here, please.
Good morning, everyone. My name is Mariam Laushi. I am from Oxfam. This year has been like no other for many of us. This is, an unprecedented experience of our time, where we have seen so many dangerous things happen, and one of the biggest was COVID-19 as it spread across different countries. Now, it was clear that Nigeria needed support and help to deal with what happened, to deal with taking care of people who may have contracted COVID-19. And what had happened was a lot of citizens made noise when donations began to come in from foreign agencies and foreign countries. And many Nigerians were concerned because of the lack of accountability and the lack of transparency with the government when it comes to disbursing funds of such a nature. And these, amounts came in large numbers. And so Code decided to take up this task and answer the call of citizens and make sure that the funds that were donated, loans, would be spent judiciously by the Nigerian government. We are happy to see that this is happening, and it is with great pleasure that Oxfam is supporting Code to do this. And so we are looking forward today to discussions that are imperative when it comes to our transparency and our accountability and where these funds are going. So I declare this program open, and thank you for having me.
Thank you very much. Thank you very much, Mimi. Please, so that we can have a very compact room, those of us sitting behind, can you please move forward? We have very empty spaces in front. Those of us sitting behind, just kindly move forward. So if you have an empty table, an empty seat in front of you, just kindly occupy the seat so that we'll have a more compact room. Thank you very much, Mimi, and our partners on this project, Oxfam. Thank you for what you have continually done in Nigeria. Ladies and gentlemen, to take us through an overview of Connected Development's activities as it ensures transparency and accountability, I want you to welcome the Chief Executive of Connected Development and the founder of Follow the Money, Mr. Hamza Lawal. Please, can you put your hands together for Hamza Lawal?
Thank you, Busayo. Good morning, ladies and gentlemen. I'm excited that we're having this town hall meeting that would inspire conversation around fiscal transparency. Let me also say good morning and welcome to over 700 people who are joining us virtually. Due to the pandemic and the impact of the pandemic, we have opened up for more citizens' engagement and participation. And I'm excited that we have over 700 people who are joining us from across Nigeria and 36 states. and who would also contribute to the ongoing conversation. When the pandemic hit Nigeria, for us at Follow the Money, we innovated because at that time, individuals, corporate entity were donating billions of naira. I'm sure you all remember when it seemed like the Billionaires Club in Nigeria were contributing their own resources to fight the pandemic. And then we thought to ourselves, how can we ensure that, one, we aggregate this public data, two, how can we document it, three, educate citizens, and four, collect feedback from citizens who are the major beneficiaries of these resources, so that when government manage it publicly, citizens are able to give feedback. So we launched a campaign, a digital campaign called Follow COVID-19 Money. Because for us, we know that one of the impediments that affects Nigeria's development is corruption. And during a pandemic, with the impact of fake news, disinformation, and misinformation, we wanted to counter misinformation by providing real-time information on how governments are utilizing COVID-19 resources. So during our mapping exercise, at first we found out that 187 billion have been donated towards COVID-19 intervention, both from government, international aid organization, and at the state level. While we were tracking this intervention, one of the key output for us was using digital tool to train over 100 young people in the 36 states to use technology tool to follow government intervention on the ground. During the distribution of palliative in Oyo State, in Kwara State, in Adamawa State, in Osun State, our reporters were able to send real-time information on the distribution of palliatives in their local communities. Also, we did a public engagement on Zoom where we had a conversation with the Nigeria Bureau of Public Procurement. We said to them, government is procuring in an emergency era. Is there a guideline on how government would ensure that the rule of law is adhered to? We also had a conversation with independent corrupt practices and other related offenses and say, what are the mechanisms you're putting in place to mitigate against corruption during the pandemic? And in less than 1 week, we saw a guideline that was launched publicly by BPE and ICPC, putting in place mechanism to mitigate against corruption, and so that government would also follow stipulated guidelines during emergency on procurement. We wrote freedom of information letters to the 36 states and the FCT. You know, interestingly, we got a response from the Accountant General of the Federation. And that was the first time government acknowledged how much they have gotten and how much they have utilized. The first response stipulated that 35 billion was gotten for the pandemic, and over 30 billion was disbursed in 4 months to fight COVID-19 in Nigeria. And then we responded to the FOI and said, can you give us a breakdown on how this 30 billion was utilized? So who were the beneficiaries? You disbursed to which MDAs and for what purposes? And then we asked them, can you also give us a plan on how you hope to utilize the 5 billion? Because at that time, there was a lot of agitation by young people, and we've gotten feedback from citizens who said they didn't benefit from palliative distribution or any sort of mechanism to cushion the effect of COVID-19. But in total, we were able to reach 9.1 million people via our various platforms. We launched the Follow COVID-19 Money Radio program with the support we got from Oxfam and the Heritage Ball Foundation. And at the federal level, we were able to track over 96.7 billion naira of COVID-19 resources. I think I want to pause and just reflect on the sad incident that happened a couple of weeks ago. Of course, we all saw on national television where citizens looted warehouses. And it was shocking to note that most of what was found, you know, jokingly we would say indomine, most of what was found were palliatives that were meant to be distributed during the heat of the pandemic. We've also had engagement with CACOVID. So CACOVID is a private sector-led coalition that is being chaired by Alhaji Aliko Dangote, and the governor of CBN, Emefiele. And we got commitment from them saying every single cent on the dollar that was donated in the Naira and dollar account hosted in the CBN will be accounted for. The last time we checked, so far they have generated 36 billion and they have a target of 50 billion to go. And just to give some aggregated data on what we tracked in specific states. In Borno State, we tracked publicly 28 million naira, in Bauchi 94 million, in Kano State 2.3 billion, in Enugu State 330 million, Akwa Ibom 28 million, Edo State 1.4 billion, Lagos State 12.6 billion, Ondo State 1.4 billion, Kwara 230 million, and Oyo State 378 million naira. In all of this, there's still a gap. There's still a gap between how governments collect data and engage with citizens, and how they're also collecting feedback on how they're utilizing resources around COVID-19. Of course, in all of this, we must recognize the role of the Nigerian Center for Disease Control. On behalf of our organization, we want to commend the leadership and the men and women who have put their lives on the line to ensure that one, Nigerian get tested, two, Nigeria gets timely information on the pandemic and keeping us abreast of how we can remain safe during this crisis period. This pandemic has also highlighted the leadership deficit we have in fiscal accountability and public health crisis. It is quite sad and unfortunate that our government, both at local, state, and national level, did not rise to the occasion. But in this pandemic, I believe that there's an opportunity. There's an opportunity for Nigeria to deepen in fiscal transparency. And with that kind of thinking and our long-term plan for an African-wide fiscal transparency, Connected Development and Budget entered a one-year CTAB, that's Transparency and Accountability Project, in 7 countries in Africa, in Nigeria and 6 other countries. I'm excited that this partnership would not only enhance the capacity of civil society in these countries, but would also provide resources for them to undertake campaigns and engage government. In some of these countries, we're supporting government to respond to this crisis and lead a citizen engagement mechanism. It might also interest you to note that during this crisis and after launching Follow COVID-19 Money, we got interest from Pakistan to lead a citizens campaign around accountability. The Minister of Finance of Haiti reached out to Follow the Money and say that we liked how you're using social media tools in engaging government and how you're building capacity for young people. How can you help us in Haiti, coming out of natural disaster and now dealing with COVID-19 pandemic. So as I speak to you, my colleagues are finalizing a framework to launch a MAGA campaign in Haiti, supporting the government to localize our homegrown initiative. I think we should be proud to say that a homegrown initiative from Nigeria by Nigerian is not only going across Africa, winning international awards, but also around the world. Pakistan, Haiti, the United Nations, the European Union is reaching out to learn from what we've been doing. I believe we can consolidate on all of these efforts and continue to hold government to account. I'm also aware that the Minister of Finance have unlocked 3.6 trillion naira to provide stimulus package through IMF for poor people. I believe that all of these resources, if you and I, as active citizens, as government, as key stakeholders, as traditional and religious leaders, as media, are able to amplify all of these findings, then there will be no place to hide or no illicit financial flow of our public resources finding her way to safe havens. I want to thank you for finding time to come, and let's have fun. As we have fun, let's learn. Let's share honest feedback and make Nigeria great again. Not in a Donald Trump's way. Thank you.
Please, can you put your hands together for Hamza Lawal? Hamza Lawal is the Chief Executive Officer of Connected Development and the founder of the Pan-African movement that has become international, Follow the Money. Please put your hands together one more time for Hamza Lawal. In very few minutes, we're going to be moving over to the States where we're going to be having engagements with various people from across all the 6 geopolitical zones. Representing the Northwest is going to be Kaduna State. In Kaduna State, we're going to be having the commissioner of the Ministry of Human Services and Social Development. We're also going to be having the incident manager, of the EOC in Kaduna State. We're also going to be having representative of the Ministry of Finance in Kaduna State. And leading these thoughts from Kaduna State will be the Follow the Money State Lead for Kaduna State, Abubakar Mohammed. In the Northeast, we're going to be taking Bauchi State. In Bauchi State, we're going to be having the Commissioner of Budget and Planning from Bauchi State in the person of Honorable Dr. Aminu Gamawa. We're also going to be having a member of the Palliative Distribution Committee and the Senior Special Assistant to the Governor of Bauchi State on Empowerment, Khalid Barau Ningi, and that state is going to be led by the Follow the Money team lead of Bauchi State, Jacqueline. In the North Central, we're going to be engaging with the Chief Press Secretary to the Governor of Kwara State, Malam Rafiu Ajakai. The state is going to obviously be led by the Follow the Money lead for Kwara State, Kehinde Akinshola. Also in the North Central, we're going to be having the Chief Press Secretary of the Niger State Governor, Madam Mary Noel Baje. Niger State is obviously going to be led by the Follow the Money state lead for the state, Richard Umar. In the Southwest, we're going to be stopping over at Ondo State. In Ondo State, we're going to be engaging with the SA to the State Governor on Health, Mr. Jibayo Adeyeye. And we're also going to be having the Commissioner of Finance from the state, Mr. Wale Akin Teriwa. We're also going to be having the Special Assistant to the Governor of Ondo State on New Media, Mr. Richard Olobode Olatunde. We'll move over to the South, where we'll stop over at Akwa Ibom State. In Akwa Ibom State, we're going to be having the Head Infection Prevention Control in the Ministry of Health, Mr. Samuel Harry. That would be led by the Follow the Money team lead for Rivers State, Mrs. Evelyn Williams. We'll stop over at Bayelsa State very quickly, and we'll have the Commissioner of Health for Bayelsa State, Honorable Pabara Newton Igwele. We're also going to be having the Commissioner of Information and Orientation, Commissioner of Information, Orientation and Strategy, Honorable Ayiba Duba, and this is going to be led by Maureen, who is the state lead for Bayelsa State. I didn't mention that in Ondo State, we're going to be led by Oluwagbenga Jongbolo, who is the Follow the Money state lead for Ondo State. Now, moving very quickly to the next thing on our agenda, if you have the agenda with you, we're also trying to keep to time. I also know that we have a representative from the Ministry of Interior. You're welcome, sir. I would get your name and introduce you to the audience, virtual audience and the audience in the room. We're going to be having 2 panel sessions. We're going to be having the state panel session, and we're also going to be having, the panel session at the federal level, which is going to be physical. Just to quickly introduce one of our senior colleagues in the development space. He's the Chief Executive Dean Initiative, Mr. Semiye Michael. Can you please put your hands together for Mr. Semiye Michaels? Please put your hands together for him, please. Thank you very much for coming. My colleague who is going to be leading the panel discussion would introduce the panelists we have, in-house today. Speaking quickly to the agenda, we're going to be having an overview of everything we engaged around COVID-19 for the period while it lasted. Please, if your hands are not too busy, I know your hands are not busy. Can you help me welcome the Staff Attorney of Connected Development, Charles Uche Esquire, as he takes us through this session. Thank you. Multimedia, please.
Yeah, thank you, Busayo. So my name is Charles Uche, and I'm the Staff Attorney of Connected Development, like he said. Permit me to stand on existing protocols, and I'm here to take you through of Connected Development's efforts in demanding accountability and transparency in COVID-19 expenditure from the period of April to October 2020. Now, for the period of April to October 2020, we sent over 90 Freedom of Information requests to ministries, departments, and agencies of federal and state governments across the 36 states. Now, let me just give a brief overview of what freedom of information means, or the essence of the FOI. Now, it's a law, it's a federal act, it's a federal law that seeks to empower citizens by giving them access, the right to seek and access information and public records, to utilize them in demanding transparency and accountability, to hold the government to accountability standards. Now, why the act has partially been successful in demanding accountability at the federal level, because it's an act of the government. At the state level, at the subnational level, it's been very difficult. The reason is simple. Many states would not respond to the FOI on the grounds or on the reasons that the state has no FOI law. And they will cite the case of Edo-Saka versus Osakwe. Now, of the 36 states, only Ekiti and Delta State had moved forward to enact an FOI law. Ekiti did so in 2011, just 3 months when the law was passed by the National Assembly. Ekiti State enacted the law. And just in 2019, Delta State government enacted the law, and it was signed by the governor. Now, the remainder of the states have continuously refused to either enact the law or obey the right of citizens to demand information. Now, okay, so this slide right here shows the applicability of FOIs to states. It's 2 different arguments. The first argument is from the first judgment of Martins Allo versus the Ondo State House of Assembly, which upheld the rights of citizens, the inherent rights of citizens to demand access to public records. Now, shortly afterwards, the case of Edo-Saka and Osakwe was also passed by the Benin Division of the Court of Appeal, which says that the government of Edo State is not mandated by any law to give citizens access to information unless that law is enacted by the Edo State House of Assembly. Now, when we at Connected Developments engage state governments with the FOI, you see that state governments now have 2 conflicting judgments of the Court of Appeal to cherry pick. So most of them will prefer to pick the latter, which is Edo-Saka and Osakwe, and deny our requests. So why would the state government deny the right of citizens to request information? Because the only way to tackle corruption is to supply information, is to be transparent. That is the only way to tackle corruption in Nigeria. Now, the nature of our information requests were simple. How much and what did you receive, and from where? How much and what have you spent, and on what? The questions were designed in such a way as to cover both expenditure, cash expenditure, and palliative distribution. Now, at the federal level, we covered so many ministries, departments, agencies, and parastatals that were participating during the COVID-19 expenditure period. So we sent FOI requests to please, can the slides move move, okay. Go on. Good, thank you. So we sent FOI requests to the NCDC, to the Ministry of Humanitarian Affairs, FCTA, Ministry of Health, Defense, Interior Police, and a list of them. Now, the sample responses we got, the sample responses is one. I'm going to make a point with immigration. Immigration, when we wrote them a request asking them to supply us with details as to their revenue and expenditure of COVID-19 funds, they said, please tender the proof of your identity before we respond to you. Now, that is one of the most absurd responses we got, and I needed to insert it here to make a point out of this. Section 1 of the FOI Act, which is the empowerment section, says that you do not need to give reason why you're asking for, why you're demanding information. By virtue of being a citizen of Nigeria, you have the right to request for information, right? And they asked us that we should furnish them the proof of our identity before responding. Other responses are things like they are unable to respond. Why are you unable to respond? You received money. You expended money. Why are you unable to respond? Other responses are the Ministry of Humanitarian Affairs, for example, we wrote not less than 3 freedom of information requests from the period of April to September. We wrote at least 3 freedom of information requests to the Ministry of Humanitarian Affairs, and it was simple. What have you mobilized with regards to palliatives? What did you receive? With regards to money, how much have you received from the federal government? What have you expended? Which states have you shared palliatives? What did you share? Sorry. Simple demands. Now, the response they gave the first time was, it's being given attention, they are requesting for extension of time. Subsequently, after a few weeks, we wrote again. Yes, you said you're going to give us, you're soliciting for extension of time. Give us information. And it did not respond again. Subsequently, later again, we engaged again, and severally, Connected Development staff, Hamzat Lawal, or myself, or Busayo, were on television. And in some of these things, the minister herself was present. And we were asking simple questions. How much have you received? How much have you expended? She could not give a tangible response, which is, it's quite sad, very sad. No, previous. Yeah, thank you. Now, the Ministry of Women Affairs and Social Development, we wrote to them, and they gave a simple response. They gave a breakdown. And they said they received 46.1 million naira from the United Nations Women. And they also received condiments, a truckload of rice, and so forth, from the Ministry of Humanitarian Affairs and from Future Assured. For those of you who do not know, Future Assured is an initiative, is a development initiative from the First Lady, Hajia Aisha Buhari. Now, with regards to how they expended this money and how they distributed these condiments they received, they said they expended 2.7 million naira and shared the condiments to 17 states that are under the United Nations Women Program, which are Imo, Borno, Kebbi, and all that. It's important you pay attention to these states that received this money or received these things, because based on the responses we got from the Ministry of Women Affairs and from the Accountant General's office, which is the next slide, we now engage the states and say, you received so and so amount of money, allegedly, from this ministry, from the federal government. What did you use it for? But I will get to the states. We are still at the federal level. Now, at the Ministry of Aviation, we requested the same information. And the minister responded, and he said he received 652 million naira from the Presidential Task Force on COVID-19, right? With regards to expenditure, he simply said, and I quote, we awarded contracts for the supply of essential COVID-19 items to both the Federal Airports Authority of Nigeria, FAN, and the Nigerian Civil Aviation Authority, NCAA. However, he omitted to give details of the contracts that were awarded, the procurement details. he omitted it. Now we engaged again and said, give us the exact amounts that were expended. Who are these contractors? What are they procuring? What are you procuring? It went ice cold from there. Ice cold. Now, he also invited us to go and go to the airport or to the places and verify or validate on ground truth these procurements. Our staff went, of course, we went to the places he mentioned and we were refused access because of COVID-19. Now, we requested information, and please turn to the next slide. Yeah, thank you. Now, this is a very crucial response. So, Connected Development in partnership with the Social Accountability and Socio-Economic Rights and Accountability Project, SERAP, we engaged the Accountant General's office demanding for similar information. Now, this information is very detailed. We had to, for the sake of this presentation and for the sake of citizens' participation in understanding the information, we have to convert it to infographs. Now, what this information is 36.3 billion was from National Assembly members, which of course they donated their salaries for 3 months. 34.4 billion were received from the federal government, and 1.5 billion were donated from private individuals and organizations, CACOVID and so forth. Now, with regards to how they disbursed this money, they expended this money, they said 36.3 billion, sorry, 22.1 billion. Let me come to this side, please. Now, as you can see here, they said 22.1 billion was disbursed to the Presidential Task Force. Now, we asked the Presidential Task Force, how did you expend this money? What did you use it for? And the response we got was a redirection to the Accountant General's office. How would the Accountant General's office know exactly how the money has been expended when it's been disbursed to that body? It is the body, it's the onus and the burden is on the body, is on that implementing agency or parastatal or NDA to show how it has expended money, and not the Accountant General that disbursed it to you. So that's one of the challenges we faced. Now, the breakdown also showed that 7 billion were disbursed to states. Now, in the response we got from the Ondo state government, there was no mention in the entire breakdown of receiving any fund from the federal government. In fact, some ministries and some states claimed they did not receive any money from the federal government, but the Accountant General's office insisted that 7 billion naira were disbursed to the 36 states. Now, there are conflicting claims, one from the federal government and the other from the state government, on how money were distributed or expended. Please take note. And another is 807 million were disbursed to the Air Force, and 500 million naira was disbursed to the police. Now, we engaged the Air Force, the police, all the states, all the MDAs mentioned in the Accountant General's response. Only 2 states, only one state agreed that they received any money from the federal government, and this is Nasarawa State. So a total of 27 states either provided an inchoate response or declined to respond to our request to provide COVID-19 expenditure details. Many of these states, Delta, Kaduna, Taraba, Lagos, and etc., declined response, citing the notorious case of Edo-Saka and Osakwe. Some states prefer to call and say, Oga, we have spent this, we have not spent this. We received this, we have not received this. And we redirected them again to please provide a detailed response on paper so we can use it to hold you accountable. We cannot hold you accountable by your words. They did not do this. Now, only 2 states actually responded to our FOIs in detail. And that is Ondo State Government and Nasarawa State Government. However, the challenge we face is that the Ondo State Government response had no dates to the transactions. How are you able to track transactions if there are no dates apportioned to them? Now, Ondo State claimed it received a total of 379 million from private individual companies and salary contributions, and expended a total of 299 million on medical and food items and face masks and other things. Nasarawa State said it expended a total of 256 million from March to June 2020, upgrading medical facilities, procuring PPEs, operating isolation center, trainings, and other related purposes. The problem with this is that most of all these things, they will put a huge amount for a very small event, inflating costs, bogus amounts, no explanation on very, very minute activity. However, we take into consideration that some states like Lagos, Kaduna, Oyo, Para had gone ahead to publish details, either in the National Daily or in their websites, on the internet, social media. Now, the challenges and recommendations is something I've already mentioned here. The Freedom of Information Act is an act that, gives citizens the right to information based on Section 1. Now, one section gives the right to information, and about 19 other sections goes ahead to give exceptions why federal MDAs and federal bodies would deny you a request. So that act definitely needs to be revisited and reviewed and amended in light of transparency and accountability standards. Now, from the responses we got from immigration and some other MDAs, it's obvious, it's very manifest that not many MDAs are familiar with the provisions of the Freedom of Information Act. So there needs to be more sensitization for federal ministries and MDAs on the provisions of the act and how to respond to information requests. Now, of course, there are 2 conflicting judgments of the Court of Appeal, like I mentioned when I started. So hopefully by next year, we would have a judgment from the Supreme Court that settles the issue on the applicability of FOI at the subnational level. And finally, lastly, the act by virtue of Section 29 gives oversight functions and power to the Attorney General for the Federation, the Minister of Justice. Now, this oversight power for the past few years have not been effectively utilized by his office. He has an oversight power to ensure that MDAs comply with the provisions of the FOI Act. Citizens and CSOs are killing themselves in this fight in demanding transparency and accountability. Now, the Attorney General has a fundamental role to play to ensure compliance with the Act, but this is not being done. So I'm hoping that henceforth, with our advocacy engagement and publications, and from the outcome of this town hall, the office of the Attorney General will take a cue and ensure that MDAs comply to information requests. So thank you very much once again. My name is Charles Uche.
Please, can you put your hands together for Charles? Thank you very much. Now, I guess we all can see the depth of the work Connected Development, Follow the Money, and other organizations in the space have been doing in trying to engage government and ensure that transparency standards are upheld to the highest level. We have a representative from the Ministry of Interior, no other person than the Director General Services, Mr. Esin Woke Silvanus. Please, can you put your hands together for him? Thank you very much for coming, sir. We also have a representative from our sister partner organization, our partners in progress, especially on the CETA project that seeks to track COVID-19 funds across 7 African countries with extension to the 52 African countries. Please, can you put your hands together for Tolu Agunloye from Budget? We also have a very big friend to Connected Development. She has been a personal friend to Hamza Lawal, and she's here today. She's going to be fully introduced on the panel session for the federal level. Please, in the interim, can you put your hands together as we welcome the founder and the chief executive of TOS TV, Miss Osasu Igbinedion. Please, can you put your hands together for her? Yeah, thank you very much for coming. We're going to jump immediately into the session for the states. Yeah, I can see some representatives from various states already on. Media, can we just have a breather, then we start up this session. Please, can you just put your eyes on the screen for a message from Connected Development.
Gwamnatocin ƙasashen Afirka da ƙungiyoyin tallafi na ƙasashen ƙetare ke ware biliyoyin dala domin gudanar da ayyukan raya ƙasa ga al'ummar faɗin nahiyar. Amma kash, yawan kuɗaɗen kan salwanta ba tare da sun isa ga waɗannan al'umma ba. Al'umma da yawa ba su ma da bayanai akan irin waɗannan kuɗaɗe, imma kuma suna da bayanan ba sa iya tambayar inda aka shigar da su, nawa ne ma kuɗaɗen, ko kuma irin ayyukan da aka gudanar da su. A cibiyar ifollowthemoney.org muna samar da dandalin da al'umma ka iya samun waɗannan bayanai, su kuma iya tattaunawa da junansu, kana su iya haɗa kansu don bibiyar kuɗaɗensu domin neman sanin yadda aka kashe su. Ta haka ne kaɗai fa za su iya tabbatar da cewa an yi amfani da kuɗaɗen don gudanar da ayyukan da aka ware su domin gabatarwa. Tuntuɓe mu a yau a www.ifollowthemoney.org. Muke bibiyar kuɗaɗenmu domin kada su ɓata, ba gaira kuma babu dalili.
Thank you very much. So very quickly, I would want to start up from. So Kingsley, you're going to help me because we're going to try to communicate both ways. I know that we have Kwara State. I know that we have Kwara State on. I also know that we have Kaduna State on for now. We're going to do this very, very quickly. From Kwara State, Kingsley, who do we have in Kwara State now? The Chief Press Secretary. Okay, great. I know we have the Chief Press Secretary from Kwara State, but before the Chief Press Secretary goes, I want to speak to Kehinde Akinshola. Yes, please. I want to speak to Kehinde. So Kehinde, if you can unmute your mic. If you can unmute your mic, let's know if you can hear us.
Yes.
Can you speak, Kehinde?
Okay. Hello, sir. Can you hear me now?
Please, can we have Kehinde speak to us, please?
Hello, sir.
His mic is mute.
Hello.
Okay, Kehinde, you need to unmute your mic yourself.
Hello, sir.
I hear you need to unmute your mic yourself.
I've done that.
Can we have Kaduna State? Can we go over to Kaduna State, please? Let's have let's have Kaduna State and see if we can hear him.
Okay. Good morning, everyone. Good morning.
If you can hear us, please, can you speak back at us?
Good morning, everyone. Can you hear me?
So while the media tries to work on this, can we just have another round of multimedia presentation whilst we try to get this sorted out?
This week at Code, we started off the new year with onboarding meetings. The whole aim of these meetings were to get the whole team on board and to work together to learn and plan the different ways that we can work to ensure that Code heights. The various trainings range from guidance from USAID and how we can get other organizations on board, to talks on how we can utilize resources and funds in a way that maximizes the work that we do and will help reach more rural communities, helping them to hold their government accountable. Members of staff were able to ask crucial questions to our visiting speakers on the different ways that Code could grow and develop. Alongside group work and observational tasks, we were able to work together to come up with concrete plans on what we would do differently to achieve different results in this year, 2020. Continue to follow the work that we do and find out the different ways that you too can get involved.
Okay, so the strategic meeting for the year, beginning the year, was an exciting one. We had the opportunity to bond with every member of the team, and it was engaging, it was exciting. We had people from the donor partners and all others came to engage us on processes for work. I mean, making things easy, and then we set out the strategies for which we are going to achieve more goals within the year, achieving our projects, they follow the money, and all other that we are running. And we are excited to move into the year 2020, and we believe we are going to achieve our goals. Thank you.
They say it's a matter of time, 1,000 days and the sun won't shine before I come back to you. When I'm happy, nothing's going to stop me. I'm making my way home, I'm making my way. For your love I will go far, I wanna be wherever you are. I know I'm coming back for you. My love is a river long, the best ride in a million wrongs. I know I'm coming back to you. And I'm happy, nothing's going to stop me. I'm making my way home, I'm making my way. I go solo, oh I go solo. I'm making my way home, I'm making my way.
Follow the Money is an initiative that advocates, visualizes, and tracks government spending and international aid. We work to amplify the voices at the grassroots levels and advocate for them to see government funds being implemented in projects within their community. If you want to be a part of this great work, join our team of citizen evaluators and community champions at www.ifollowthemoney.org.
Joining us now on Skype from Abuja is
following speculations that most people will require such services for COVID-19 tests.
Give us specific details, every single kobo on how you utilize COVID-19 resources during this pandemic.
So apologies, guys. We're trying to fix this from the back end. I think can the state team, the state lead for Kaduna, can you speak back at me? Let me know if you can hear me.
Okay, can you hear me? Can you hear me?
Oh, just hold on a minute, please.
Newborn and maternal mortality.
Can you hear me?
These are daily realities of over 100.
Yeah, I can hear you.
Can you hear me?
Problem further ones.
I can hear you.
Girls and children.
Can you hear me?
Especially in marginalized grassroots.
Yes, I can hear you.
Every year, Nigerian government budgets and releases billions of dollars in addition to foreign aid. In a
Can you hear
country
me?
where corruption thrives and government accountability is
Yes, I can hear you.
porn for grassroots.
Okay. Just keep on saying something. Let's put this audio together,
Our
please.
work through Follow the Money becomes
Okay.
difficult. Follow the money.
Good morning.
Where funds are coming from, where they're going to, and
Can you hear me? Say hi.
they are being.
Hello, I can hear you.
Hello. Hello, guys.
Yeah.
Sorry about the breaking transmission. We're just putting this audio together and then it's coming good. Okay.
All right. We're back. We apologize for that breaking transmission. Technology has been a veritable choice for us to engage across many spaces in time. Okay, great. We're back now. The Kaduna State lead, can you unmute your mic now and speak back at us so that we can hear you, please?
Good morning, everyone. Can you hear me?
Great. Yeah, we can hear
Can
you
you
now.
hear me?
Thank you very much. Yeah, thanks for your patience. Just in about 60 seconds, please just give us a rundown of what your team in Kaduna did before we move over to the perspective of the government to listen to what the government did. Go ahead, please.
Okay. Good morning, everyone. My name is Abubakar Mohammed Yanko, and I lead the activities of Follow the Money here in Kaduna. Since the outbreak of COVID-19 in March, Follow the Money team has been working tirelessly to ensure transparency and accountability in the distribution of palliatives in the state. We have Follow the Money champions across Kaduna State, which we are able to monitor these activities. And from the reports we got, there were various challenges that we faced. The first challenges we had was that there was no transparency in the distribution processes. And then the second is that there was no measurable amount of palliatives that was supposed to be distributed per ward. And then the state government listed out 8 local governments that were supposed to benefit from these palliatives here in Kaduna, among which we have Zaria local government, Sabongari, Jama'a, Kaura, Chikun, Kachia, Kaduna South, and then Kaduna North. So we have our Follow the Money champions in Kaduna North, Zaria, and then Kaduna South, where we're able to get information on how these donations were done. So from our own view, we send letters to Ministry of Finance, Ministry of Health, and the Ministry of Human Services and Social Development. From Ministry of Finance, we got a feedback that there was no, that we don't have an office here in Kaduna. That was part of the response we got from them. And then the second one is that they are not, they will not be able to give us this information we are requesting for. And then from Ministry of Health, we have response from them that only the governor of Kaduna State will be able to give us this information. And then from Human Services and Social Development, we are not able to get any response from them. So in brief, as what we actually got from Kaduna State during the COVID-19 intervention and donations in Kaduna.
Yeah, thank you very much, Abubakar. Now, I just wanted to know from you in just few seconds, did you feel that Kaduna State was able to manage the fund that came into the state for COVID well, in your own opinion?
Okay, in my own opinion, since Kaduna State is part of the OGP and they are trying to be transparent, they made available of all these materials to be on their website. Citizens can actually get this information but we can't really say that these materials were distributed judiciously according to what the state government is saying.
Okay, great. Thank you very much. Let's hear from the perspective of government now. I know that we have the incident manager of EOC in Kaduna State, Dr. Neyu. Is he on call now? Let's have him speak to the perspective from Kaduna State. Now, I just wanted to quickly state that it was difficult for our state teams to go on the field because of the lockdown. It was very difficult for the state teams to go on the field because of the lockdown. Hence, the need for us to just abide by the COVID-19 rules and regulations and stay away from a lot of these challenges. Do we have the representative of the government on? The incident management, yeah. Doctor, please, can you unmute your mic and turn on your camera? Maybe I just say that all the people we have on the panelist link, if you could just help us open up turn on your cameras and unmute your mic. Dr. Neyu, if you can hear us from Kaduna State. Kingsley, can we request that? Okay, we can see him. Yes, can you speak back at us, sir?
Oh. So okay, you can hear? Can you hear me?
Yes, we can hear you. Yeah, go ahead.
Hello. Can anybody hear me? Can anybody hear me?
We can hear you, sir.
Hello.
Yes, we can hear you. Go ahead, please.
For the opportunity to be here among all of you on another. Okay, I was listening in when I can. I just finished the activity and I was just driving off from the venue when I had the finance given the update for Kaduna State. So had his opinion on if the state was judiciously using the funds that were allocated to. I'll gladly say utilizing the funds from both the state government and also from funds, materials, infection prevention and
Can we quickly switch over to Kwara State? Can we quickly switch over to Kwara State? I guess his network is very terrible. Akinshola Kende, if you can hear me, can you unmute your mic and speak to me? In Kwara State, what was the situation like, all through your COVID tracking in Kwara State?
To Kaduna State and
Kende, can you unmute your mic
Hello?
and speak back to us?
I'm sorry.
Hello. Hello.
Mute your mic, please.
Hello.
Okay. Hello.
Yeah, Kende, if you please, can we ask him to unmute his mic?
Hello, Busayo. Hello.
We're still pinned on Kaduna State. Can we go over to Kwara State?
Hello, Busayo.
Okay, guys, can we speak to the Chief Press Secretary and know if she's available to? I guess that's from Niger State. The Chief Press Secretary, to the Governor of Niger State. Yeah, how you doing, ma'am? Good morning. Can you hear us? Please, can you unmute your mic? Your mic is still muted.
Hello?
Yes, can you hear us now, ma'am?
Am I audible?
Can you hear me?
Yes, I can
Can
hear
you hear
I
me?
can hear you.
Yes.
Yes, we can hear you.
So sorry that
Yeah,
the
good
network
morning.
was acting up. So let me pack
I'm
it.
on.
Okay,
Hello?
just doctor, just hang on. Doctor, hang on. Let's speak to the Chief Press Secretary of Niger State, then we come back to you, please.
Oh, okay.
Yes, thank you very much. You can go on, madam.
Okay, good morning all. I must commend you for coming up with such a program, having known what Nigerians and Nigeria went through the past month. But like our story in Niger State, I guess we're among the first 3 states to go into lockdown when the issue of COVID-19 came into being. And I would like to say my governor, Dr. Abubakar Sani Bello, was proactive in the sense that he showed leadership, proactiveness by evolving strategies to contain the spread of the global pandemic. And following that, he went into constituting a task force, which was headed by the state SSGs, the Secretary to the State Government, Ahmed Matene, including relevant MDAs, religious bodies, and women as part of the committee members. Going further, he came up or created isolation centers, isolation rooms all over the 25 local government areas, and disinfected public places, as well as established quarantine centers in principal towns comprising the 8 emirate councils. He also went further, which is most concerning, that the issue of palliatives, where to cushion the effects of the lockdown to the vulnerable or on the vulnerable. We came up with the acquisition, will I say, of palliatives. Palliatives were acquired for over 300 billion, was shared to the vulnerable in the society, while good men and women of goodwill and character also joined in adding their voices to what the government has done by contributing in one way or the other. And coming down to distribution of palliatives, we also have the input of the federal government palliative, as well as that of the First Lady of the Federation, that is Hajia Aisha Buhari. Palliatives are also brought from that end. And in all this, it helped, or it went a long way in the ameliorating the sufferings of the people. In various ways, like I said, the government came into supporting the people under lockdown, even where we had the problem of light, because at a point, Niger State was only enjoying light for like 2 hours. And you can't tell people to go down without giving them the necessary backing. So at that point, the state government had to, pay up, make up by paying up bills to ensure that people obeyed the law in place, and there were closure of borders, there was supervision of inter and intra movement, interstate and intrastate movements to ensure that people, obeyed the process then, and so as to reduce the effect of COVID. But then we also had one major thing which led to a crisis. For thank God for Niger State, which is the EndSARS crisis. We had the COVID support, but COVID had a template they were working with. And at the point of the crisis, due to the proactive nature of the state, the House of Assembly in its transparency and accountability process also called the committee to give account of what they expended, how they acquired and expended the money that was given to them, which was about a little, I think, over 700 million was expended. So due to our proactive or the state proactive nature and the governor's point of follow-up, the House of Assembly also followed up to find out that the state has spent this amount of money, and they gave breakdown of how the monies were expended. Then, like I was saying about the COVID, we had a template, or the COVID had a template, but we thank God that even with the template, Niger State was ahead of the EndSARS program crisis by ensuring that these things, like I remember my governor would say, just give these things out to people that need it. Because at the time we had shortage, we had about 8,000 bags of rice to be brought. That was what we had left before, or maybe a month to the crisis.
Madam Secretary, we can hardly hear you. We'll definitely come back. We'll definitely come back to Niger State.
With all our friends,
can we have Kende back? Kende.
Okay, Busayo, I'm here. Can you hear me now? Hello, Busayo, can you hear me?
Who is it?
Hello, Busayo.
Over time in Africa, billions of dollars
Hello, Busayo, can you hear me now?
Have been set aside for development projects in rural communities across the continent. Unfortunately, most of these funds never get to these communities.
Okay. I guess we can hear Kende loud and clear now. Kende, how you doing?
Okay, great.
Yeah,
all right.
Good. Go ahead, please.
Yeah. All right. Thank you. Good morning. My name is Kende Akinshola. I'm the team lead for Follow the Money here in Kwara State. Yeah. Let me start sort of because of my time. When the Kwara State government started receiving donations in March, the donation started coming up in March 27, 2020, and people started to give the state donations. Started with the BUA chairman and later UBA. So the team, the Kwara State, felt that it's really good for us to document all these donations, because by the time the much inflow of the donation comes, we might lose or lose the flow of those donations. So we started open a Google sheet for it. So donation come in, the CPS, they will announce, thanks to the government, they will announce the donation they receive per day or in a particular day of the month. So go to April. So we'll keep writing those donations down. So by the time the government now, the only issue we have that time was there was some donation the state received that they didn't give the actual amount of the money received that time, because they will say maybe, like using the governor as an example now, the governor said he gave out his 1 year salary for as a donation. Nobody know amount the governor received for that. And later there are some individual that gave out percentage of their salary. There are some that say they give. So later at run, the state later come with the amount received for donation, which is 243 million naira for donation. that donation received from 27 March to July 2020. So let's come back to the palliative now. Around April state, and there is total lockdown, no movement. The Kwara State government started with palliative, sharing foodstuff to citizens in different local governments. So local government, 8 local governments in the state received the palliative, the foodstuff. They received those palliative. Why other 8 local governments in the state, in their own decision, in their own thinking, they told the government.
Kindly, yes, thank you. Let me hold you there. I just wanted you to speak in few more seconds. What was your thoughts around how Kwara State government managed COVID funds that came via donations, via federal government subventions and all? What are your thoughts on how those funds were spent in Kwara State?
Okay, to me, the Kwara State government, they did some good things with the spending of COVID-19. For example, there are some equipment that we don't have before in the state. The government use those money, but we must also know that according to the government, they said the donation that they received, that until now they have not spent it. And the only thing I can say about now, the Kwara State government have not even updated the citizen about amount they have spent. The last time they did was that was in July 2nd. That was when they said the government has spent 1.5 billion naira on COVID-19 in Kwara State. So from July to now, citizen does not know, Kwara State, Kwara does not know amount of money the state has spent so far. And the amount the government said they spent on the palliative, which is 525 million naira, that one also raised so much questions, because I was able to monitor the distribution of palliative. So that money made us to write an FYI letter to the technical committee on COVID-19 to like give us the breakdown of how the state spent 525 million naira on palliative during COVID-19, because that till now we have not get a breakdown of how the 525 million and all of that things, like the medical supply, which also takes. Thank you. All right.
Yeah, thanks a great deal. Thanks a great deal. Let's just quickly wrap off with the Chief Press Secretary, in Niger State. Your network went off, Ma. I wanted to just ask you just one final question from Niger State. Now, how do you think your state government actually expended funds? That's number one. Number two, are these expenses in public domain in your state? Is it anywhere on any website, anywhere in your state? Can you unmute your mic, man? We can't hear you. We can't hear you. Sorry, would probably want to come back to you. I think we have an issue in-house. We can't hear you in. And I know you can hear us clearly, but we can't hear. It's not from you, ma'am. It's from in-house. Yeah, so when we rectify this, would come back to you. Do we have any representative from Kwara State government? Do we have a representative from Kwara State government?
Yes, we have.
Yes, the Chief Press Secretary from Kwara State government.
In our president now, we have the Chief Press Secretary.
Okay, great.
Yes, he's here.
Yes. The Chief Press Secretary, Star or Ma, if you can hear us, can you unmute your mic and speak to us very quickly? My colleague in Kwara State says from July, there has been no update on the amount that was spent, from COVID, like it was before the last update in July. If you can hear us, sir, can you please turn on your mic and speak to us on this, please?
Yeah, good morning. Can you hear me?
Yes, we can hear you, but can you turn on your video so we can know who is speaking to us in the room?
My video is on. Can you see me now?
Yes, we can see you. Okay, yes, go ahead, Malam. Thank you very much for joining us. Did you hear my question or you want me to go again?
Please come again.
Okay, my colleague said from the last time there was an update on COVID-19 expenditures in Kwara State in the public domain was in July. Now, can you speak to us what has happened from July up until December 2020?
Well, thank you so much. It is gratifying to know that Kwara State is one of the few states that made the expenditures, COVID expenditures, open to the public without being pressured to do so. Just like Mr. Kehinde has said, as at June 29th, 2020, we've spent 1,569,107,944 naira 70 kobo. We released that on July 3rd, 2020, just like he has said. As of today, I want to announce that we have spent a total of 2,278,327,302.55. In summary, let me add also that we announced to members of the public that we received a total number of, hello, can you hear me?
Go ahead, we can hear you.
That we got 243 million naira, a total of that. By the time you add the governor's donation to it, that comes to 255 million naira, that is donation. But we announced to members of the public that these are public funds and this is a democracy. We cannot just go ahead and spend such funds without first going to the assembly to appropriate same. So we have done so, and we also announced to members of the public, I remember speaking on this repeatedly on radio station locally here, that these funds will be spent on some medical equipment here, because it will be interesting to know that as at March, when COVID happened here, the Kwara State did not have any isolation center. So that made our own case slightly different. We had to start from the scratch by putting in place relevant facilities and equipment to take care of COVID. And of course, we also spent on the palliative, just like he has said, and Kwara State is possibly one of those few states, if not the only one, that invited civil society groups to monitor how palliatives were distributed to members of the public.
Thank you very much, Malam. You still didn't speak to the question I asked, the second question I asked.
Which is what?
The last update on COVID-19 expenditures, was made in July, from July to December. Yes, does it mean that Kwara State has not spent any fund within this period of time?
I think I've answered that. You possibly missed that. I mentioned that as of today, we have spent 2,278,327,302.55 kobo.
Okay, great. Thank you very much. Now, this is just also requested lastly, because I know that all these funds, like you've said, are going to be appropriated and is going to go through the procurement process. Would Kwara State government be open enough to have civil society organizations engage through that process and ensure that there's value for money on how you guys are going to be spending the funds?
We have always ensured that. It will interest you to know that Kwara State has what we call social audit, whereby we invite members of the public, non-partisan usually, to monitor what we do with public funds.
Okay, thank you very much, sir. Can we go back to Niger State? The Chief Press Secretary has been waiting. I also know that Richard, who leads Follow the Money in the state, currently is he online? Is Richard online?
I am.
Okay, madam. So just so that we don't take any much of your time, please. Okay. We discovered that the expenses of Niger State is not in public domain. Can you speak to that? Because if you want to build a transparency network, citizens must be able to have access to those kind of information.
Yeah, I'm sorry, that won't be too correct to say that they spend your expenditure of the COVID-19 fund is not in the public domain. It is in the public domain, and that was where I was taking you to that. because of its transparency and accountability position, the State House of Assembly invited the stakeholder, the committee members to explain how much was disbursed to them and how they expended it. So with this, there were publications, even right from time immemorial. You know, that was after that presentation. It was brought to the public domain. They spent over 700 million naira. And I know that 300 million naira was for purchase of food items, while the others were for the settlement of, for setting up or buying of medical supply and the movement of Alimajiri from the states to other states. So all these things were all encompassing. But I know the state gave in about a little over 700, I think 780 something million naira, and that is about 800 for the COVID program. So this knowledge has been in the public domain, because I know that 2 months back or thereabout, we're making headways with the presentation at the House of Assembly. And people can also check on nigerstate.gov.ng for more information on the expenditure.
Thank you very much, Madam Secretary. Thank you very much. Thank you very much for also coming. I wanted to speak to my colleague in Niger State, but I don't think he's currently online. I don't think he's online. Okay, so can we quickly go to Bauchi State?
Online. Hello, Busai, I'm online.
Okay, great. Thank you for joining. The Chief Press Secretary said information around COVID-19 is in public domain. You guys have been able to track a level of fund for COVID in Niger State. Can you quickly speak to that?
Yeah, actually, we were able to reach, we wrote many letters to the Commissioner for Finance. We wrote to the SSG, who happens to be the chairman of the COVID-19 task force. But we only got response from even the office of the Chief Press Secretary. We only got response from the office of the Chief Press Secretary and the office of the Commissioner for Finance. Actually, the Commissioner for Finance had to place a call to me to make it categorically clear that the fund for COVID-19 was with the State Committee for COVID-19 State Task Force, which was headed by the SSG. But all efforts to reach out to the SSG was proved abortive. But from my findings online, there was a website I saw, though it was not having full information on the donations that came in for COVID-19 to Niger State. Though I saw 24 donations at that time, as if it was a new website that was just being, information was just being uploaded, but was not fully, we didn't have the full information on the total number of donations that came into the state. Though getting access to information has been very, very difficult, especially through the Ministry of Information. But the Office of the Chief Press Secretary was accessible and receptive, and that of the Commissioner for Finance responded. So apart from these two responses, and that was why we're able to bring her on live here today. So apart from this, we didn't get any response, and till the last time I checked, there was no response coming from the office of the Secretary to the State Government.
Thank you very much, Richard. There's music playing in your car. Can you turn that down so that we can hear you clearly? Yeah, thank you very much. Maybe I should go back to the Chief Press Secretary. Madam, are you going to be able to commit to Nigerians, especially your citizens in Niger State, that when they come for information on what government is spending, on, the state will be able to open up its books for citizens to be a part of the governance process? We can't hear her again. We can't hear you. We can't hear you, Ma. Wow. Sorry. We may have to come back. Okay, hello? Yes, we can. Go ahead, Ma.
Okay. Thank you for coming back to me, and I'm really sorry that this is coming at this time. We are not a government that, is in hiding or hiding anything. We have an SSG actually that is very open to information. So I guess he didn't really get him at the right time. And that's why any channel you come through, as far as you get to my table, we'll be able to get out the information needed. And since he has gone through this, I'm promising him that we're going to work closely at whatever point to ensure that we give out our information as needed, because there's no need. I'm a journalist, home-based journalist. I don't think we need to hide anything. What sharing is what sharing. So from now onward, I give you my word as you ask.
Thank you very much, madam. Thank you very much.
You're welcome.
Let's move to Bauchi State. I can see my colleague Jacqueline from Bauchi. Jacqueline, how you doing this morning? Jacqueline, can you unmute your mic, please?
Good afternoon. Yeah.
Yes, Jacqueline, go ahead. What happened?
Can you hear me?
Yes, what happened in Bauchi during your tracking? Just in 1 minute, please.
Yeah, we sent out FOI letters to the Ministry of Budget and Planning, Ministry of Health, and the government office, but all didn't yield any positive report because none of them replied to our FOI letters. But due to my own finding in the state, we got some little information that from the civil society, they had they gave donations totaling to 58,659,355. Then it was also stated on Twitter, that is the Bauchi version, it's their Twitter handle there. They stated that 10.5 million was given by the State House of Assembly. So those are the only things you could get. The Ministry of Budget and Planning said they do not have any information concerning the funds that came into the state. We should contact the Emir, who happens to be the head of the palliative committee of Bauchi State. And we haven't been able to get through to him yet.
Okay, thank you very much. Thank you very much, Jacqueline. Let me quickly, I saw Ondo State, is Ondo State on? I saw Ajos, the state lead for Ondo State. Ajos, if you are there, can you unmute your mic and quickly speak to us in 1 minute? What was your tracking experience in Ondo State like? Ajos is freezing. What other states do we have? What other states do we have on?
Okay, yeah.
Go ahead, Ajos, if you can speak, if your network would let you. Wow.
Yeah, fine. Good morning. Yeah, good afternoon. Yeah, my name is Oluwagbinga Jombolog for the.
Yes, go ahead, we can hear you. Wow, he's freezing. Multimedia, please, can we just have another slideshow so that we switch over to the federal panel session very quickly. After what you're going to see on the screen, I'm going to be inviting my colleague, Lucy. Lucy leads or heads the programs department at Connected Development. She's going to be the anchor, for the panel session, the next panel session we're going to be having. Just after we take the message from the multimedia department behind.
All right, good morning, ladies and gentlemen. Thank you everyone that is joining physically and for our participants and state leads across the state that are joining virtually. We are so sorry for the network challenges, but this town hall meeting was supposed to be a closed-door town hall meeting that will help us to aggregate what has happened across the states and for us to get feedback, real-time feedback on the situation on ground, because we wanted to find out what has been the update so far across 36 states and the 6 regions of the country on transparency and accountability issues with COVID-19 funds donated for the fight against the pandemic. But so far, we've gotten feedback and updates from the staff attorney for connected development on the statuses of our FY letters, of course, which were used to assess informations from ministry departments and agencies across 36 states and in the FCT. And for this panel, we're going to be having originally we had plans to have the federal government, ministries, departments, and agencies represented on this panel, but most of them that have confirmed today, and some in this hall, have not been given the pass by their bosses to join this panel. So this panel will just be centered on civil society organizations and representative across, different agencies and organizations that are working around transparency and accountabilities and other issues. So with me on this panel this morning, please help me to welcome our donor, a representative from our donor agency, Oxfam Nigeria, Miriam Lauch. Please put your hands together as you come up. Can you help me to clap? She's a beautiful lady and will not mind you clapping her until she gets on her seat. Thank you so much. Thank you so much. I think the room is quite cold and people's hands are already very icy. I don't know if we can get the ACs turned down a little bit. Please, we also have the chief executive of the TOS TV, Osazu Ibenijan. Chief Osazu Ibenijan, please can you put your hands together for her to join us on this panel? Thank you so much, ma'am. And we also have physically, I think we have 2 female already, so to balance the gender physically, we also have the programs manager for Budget Nigeria, my friend and partner to code, Tolutope Agunloe. Please put your hands together for him as he comes on stage. Then virtually, we're going to be having 2 other panelists that will join us virtually. We have Miss Toyosi Ogun CG, the Chairperson Victim Support Fund. She's joining us online. And we also have a representative from Data Fight Nigeria, Remi Oje Kunle. Sorry, I'm not Yoruba, but I hope I've not murdered your name. Good morning, everyone. I hope you enjoy yourself this panel. We have less than 30 minutes to run through what we've done across different organizations in the fight against COVID-19 and how we can bring solutions to, the ever-increasing problems that we face in Nigeria. But as an introduction, I want to say that Nigeria is signed on to the OGP, and as we speak now, we have over 12 states that have signed on to the OGP, but the reality on ground is different from what we see on paper, because most of these states that are signed on have not still developed a framework, a working framework, and a realistic framework that they could provide timely information to their citizens. Of course, the Open Government Partnership allows you to provide information or makes it compulsory for you to take on your citizens in whatever implementation plans you have for them. So for my friend and my colleague from Budget Nigeria, I know we've been doing a lot of work around the COVID-19 and tracking funds across the state using the tracker platform. Please, can you just give us a breakdown on what Budget have been doing and your findings, challenges, and of course, when we move on, we'll ask for recommendations.
Okay.
Good afternoon, everybody. So I've been asked to talk about what budget did. So let's start from the relevance, which is data access. Now, when COVID struck, what we had to do was to innovate. And one of the things we did was to ensure that there is access to information on what has been donated to ensure that there's intervention in order to stop the COVID pandemic. And we set up a digital portal called COVID Tracker, which can be found on civichive.com/COVID-19 tracker. So what's the purpose of that portal? Is to have all the information that has to do with money. You know, budget is much more interested in anything that has to do with public finance. So we have the donations there. However, we don't have the breakdown. Now, the breakdown in terms of the disbursements to states. And one of the things we try to do is to ensure that access to information, which is a key component of the OGP, while we also have fiscal transparency. Now, on access to information, we decided to test the importance of that using the FOI request. So we wrote to lots of the MDAs asking for information around the expenditure, what they've received, how they've spent this money. And we didn't do this alone. So there's a coalition, which budget is also part of, which is called the FOI Coalition, which has 6 organizations. The first one, Sarah Budgets, PPDC, MRA, ICIR. And what we did was to write 213 MDAs asking for this information. Now, you know, the issue around FOI, non-response. For those that responded, the informations were not tangible enough. At a point, we even got intimidated. For example, Ministry of Defense. When we wrote Ministry of Defense, they sent in DSS to visit our office here in Abuja. And they came asking irrelevant questions. Irrelevant questions like, what's your CAC registration? Who are your board members? Questions that has nothing to do with the information we asked for. And normally the response we gave them was to make it official, write us officially, then we'll also give you this information. Because what we did was to write you officially. So if you write us officially, then we'll reveal all this information. And another question they asked was, who is also, like the journalist asked, who is bankrolling you? And we had to tell them that, okay, so for the annual report is available on our website. You can easily go there, download a copy, and you'll see the funds we've received, the donors that are funding us, how we spent the money, the breakdown. And because we are also leading by example to say that the funds that we received from donors, and this is how we spent it. And so they left in annoyance. We didn't hear from them. Now, based on the 213 MDAs that we wrote, like I said earlier, we only received tangible response from 30 of them. And those 30 of them decided to do a ranking. Like I said, in partnership with other organizations. So we ranked them. So if you go to foivault.ng, you'll see the ranking there of all the 213 MDAs that responded. And we decided to do a ranking to say, okay, to also encourage MDAs that know much about FOI. And so it's not about naming and shaming, it's also about ensuring that those that don't know about the FOI knows about it. One of the things that has been mandated for the MDAs is to ensure that there is an FOI desk in the MDA. So which simply means for every response or for every request that is made to every MDA, there should be an officer. His job is to attend to every request that comes in through freedom of information. And we noticed that most of them don't have, because that was part of the questions we also asked them. And so PPDC, which is also a sister organization, is responsible for training the MDAs that don't know much about FOI. Now, the main reason why I'm giving this information is about the OGP, and I said, which is access to information is a component to it. Now, aside from writing the 213, what budget also did was to write the state government. Now we wrote the state government, the 36 state governments, and so far, 8 have published their spendings on the website publicly. So if you go to the Kwara State, you go to Lagos State website, you go to Ondo, you go to Ekiti, you have all this information there. But then those information might not be tangible enough for you to be able to track the actual spending. Like I said, we are more interested in the finance aspect of what have they received and how it has been disbursed to citizens. So I hope, Lucy, I have answered some of your questions.
All right, thank you, Tolu. So we have 2 minutes to respond to a question, and so we don't spend so much time. So I think I'll move to Chief on the panel. So I want you to share real-time experiences, because we know that you, during the pandemic, you were on the field and distributing some palliative to, the disabled, the people that needed those help at that period in time. So I want us to share information sharing between the government and the citizens during COVID-19 lockdown and the pandemic. How transparent was it? Are the people on the ground feeling the effect of those palliative that government have said they distributed across communities?
Thank you so much for that question. During lockdown, I think we saw a complete disconnect between the government and its citizens. I mean, people were yearning for as little as, a mudu of rice or gari, and they couldn't get it. Yet billions of naira, billions of palliatives were said to have been distributed, but with the whole Sorosoke process and the NSAS, we saw that they were actually not being distributed. They were stored in warehouses across the 36 states of the nation and the FCT. So what we tried to do with TOS Foundation is to continue to do what we do best, which is to empower the lives of women and children across these different states with palliatives and startup capital to sustain their small to medium scale businesses. And due to the increase in domestic violence during the lockdown, we specifically focused on creating safe houses with NAPTIP, the National Agency Against the Prohibition of Trafficking in Persons, which also focuses on providing safe houses and shelters to women who were being battered. So we partnered with them, we gave them palliatives in collaboration also with Blade Farms here in Abuja, and we were able to get some women some shelter during this lockdown period. We also used our media network, TOS TV Network, which is a Pan-African television station, to shine light on the work that foundations such as ours was doing, and also to hold government accountable. The work we did was not as data-driven as CSOs like budget. However, we're able to ask those in power pertinent questions on how they were, driving down the dividends of these palliatives and goodwill that they were receiving from donors across the world to the poorest of citizens. But I would actually like to say that we failed as a media organization, because when we finally saw, what was going on, we were shocked. We were completely shocked that fellow human beings could do this to their, common man. People were dying because they didn't have food to eat, yet you were letting food rot in a warehouse. I mean, a normal thinking person cannot do that. So I was very shocked to see that happened. So I believe that we failed as the media, and I believe that more still needs to be done, and conversations like this need to continue. So I want to use this opportunity to thank Code Hamza Lawal for putting together an auspicious gathering like this, and I hope that the conversation continues.
Thank you so much, Chief. So why I asked that question particularly was because most people don't understand when we talk about transparency and accountability. It fits into every system of the government. It fits into poverty, it fits into education, it fits into the health sector, provision of basic hygiene to the common man. And so I moved to Miriam, and the National Bureau of Statistics in May 2020 released a poverty and inequality report in Nigeria, which highlights that 40% of the total population, or almost 83 million people, live below the country's poverty line of 137,000 naira per year. And in October 2020, Business Day released the poverty report that 7 million people were forced into poverty in Nigeria due to the socio-economic effects of the COVID-19 pandemic. Other sources have projected more, in addition to crippling food insecurity. My question is, how can Nigeria breach this rapidly widening poverty margin worsened by COVID-19 and in attendant food insecurity? Okay, how can Nigeria breach this rapidly widening poverty margin worsened by COVID-19 and its attendant food insecurity?
So there are many ways to deal with, that inequality gap that has been created, over the years in Nigeria and has been worsened by COVID-19. And one of the ways, of course, is what code is doing, which is following the money. Unfortunately, there's just so much corruption in Nigeria, and a lot of the time we find that monies that are allocated to different issues, such as healthcare and education, don't actually get to the people that they are meant to get to. And so, how do we deal with this? And I think an easy example of this issue is the fact that palliatives were still in warehouses and they should have been distributed a long time ago. And these are the people that are supposed to be, taking care of citizens and making sure that hunger doesn't affect them. If these people are still holding back palliatives, whether it's due to corruption or due to bureaucracy that doesn't allow them to quickly do what needs to be done to support people, then that is a problem. The federal government and state governments need to take they should prioritize the welfare of the people at every level. There is really no excuse for late distribution of those palliatives. There are so many other ways, that need to be channeled if poverty is going to be alleviated. We know that the federal government has a lot of initiatives, but clearly those initiatives are not enough. Clearly, COVID has brought a new kind of challenge that we obviously have not been prepared for. So the government needs to make more effort. The government needs to make sure that this poverty is dealt with in a holistic way, because it takes a lot more than just even following the money. It takes a lot of work to make sure that Nigerians come out of poverty.
Thank you so much, Miriam. So I think we move to a virtual panelist. Okay, so I'll be directing my question to Data Fight. Please, can you say now that your mic is unmuted?
I'm here. Hello. Yeah, I'm here.
All right, so thank you. So in July, Data Fight published a report on how the Federal Ministry of Health, NCDC, NSCDC, FRSC, and NPHCDA mismanaged 1.7 billion COVID-19 funds through bogus procurement. And in November, Data Fight also published that in an anti-corruption radio program revealed that COVID-19 procurement scam on how federal MDAs mismanaged at least 3 billion in COVID-19 emergency procurement. So I want you to shed more light and provide some insight and your organization's efforts in holding the government accountable based on your report so far.
Okay, thank you for having me. My name is Adiremi Ojekunle. A senior reporter with Data Fight. So we have tracked and we have published a number of stories as regards COVID-19 procurement and intervention projects across MDAs. And what we've noticed in the couple of our stories where we noticed bogus amounts, just as you said, we noticed how MDAs hide under COVID-19 emergency procurement to inflate prices, to even infuse projects that were not meant for COVID-19. For instance, the Corporate Affairs Commission procured laptops during COVID-19, and we were wondering if laptops were consumables. And also we also saw how that same ministry bought tent and shares for millions of nairas just to register people during COVID-19 pandemic. Amongst other things were contractors that were not even registered with CAC that were given contracts, contractors that did not meet federal government requirements to get contracts from the government were given contracts. So when we asked these MDAs, why were these? Why did you give contractors they were not supposed to contract? So they hide under COVID-19 emergency procurement guidelines. And the guidelines is out there for everybody to see. The guidelines simply state that even if you want to do emergency procurement, you have to ensure basic rules in procurement, which is your procurement must be transparent enough. There must be value for money in that procurement. So for you telling us, so we also went further to ask the Bureau of Public Procurement, okay, you made this guideline, you make this emergency procurement. So what happened after all this happened? And we were told that, okay, at the end of the day, MDAs will still have to send details of whatever they procure, whatever things that, whatever contracts they've issued out, they have to still pass it back to the Bureau of Public Procurement for cross-checking. So we went further to ask the Accountant General, and what we met there was basically a blame game. The Accountant General telling us that the Open Treasury Portal, which is available for everybody to see and to check and track payments of items and contracts, the Accountant General said it's basically MDA's issues. It has nothing to do with the Accountant General. But the OTP, the Open Treasury Portal, is domiciled within the office of the Accountant General. So why would someone procure 1,000 face masks for millions of naira, face masks that we know that even during COVID-19 pandemic, the highest price you will get in a face mask is 1,000 naira, and you are procuring just 1,000 naira for over millions of nairas, and the Accountant General is telling us does not know anything about this. And so that's so also recently we also checked the NOCOPO portal, which is the Nigerian Open Contracting Portal, and we realized illegal activities going on that portal. So one ministry that we noticed sharp practices was the Ministry of Water Resources. So the Ministry of Water Resources made procurement amounting to 1.2 billion naira to fix water and pipes in some community or in some states. They didn't state which of these states this particular contract is going into. So we wrote an FOI letter to them. Okay, can you give us guidelines? Can you give us breakdown of how this 1.2 billion naira will be spent and how much you've spent so far on this payment for COVID-19 intervention projects? And to our surprise, within the 7 days stipulated for the FOI request, the Ministry of Water Resources had to go back to that same portal and erase over 328 million naira from the procurement deal that they've actually put on that same portal initially. And we asked them, okay, give us the details of these contractors. And also, just as usual, we noticed that these contractors were companies that were not even registered with the CAC, companies that are not on the Bureau of Public Procurement website or do not have and are not verified to get contracts from the federal government.
All right, thank you so much. Thank you for your feedback. Okay, so I think I will direct my next question to Ms. Toyosi. Please, can you try to unmute your mic?
I can hear you. Can you hear me?
I can hear you clearly.
Very
In
well.
fact, that's the loudest we've had today. All right. All right, so my question directly to you is that as the chairperson for the VSF Victim Support Fund, we know that COVID-19 further revealed the deployable state of our education and health and work sector, most especially, and how much we needed to feed and poor Nigerians across the nations. So my question is, what was your experience on ground? We know you did a lot of work around COVID-19 across, and I know you've gone to over 14 states trying to reach out to victims and people living with disabilities, women and girls. Can you share your experience with us?
Thank you very much, Lucy. My apologies. I actually planned to be there to, participate in the physical session today, but unfortunately I couldn't. I spent the last 18 days across 10 different states, covering the south, north central and the northwest. And we'll be back to Abuja next week to begin the commissioning of the water projects across 18 different states, 54 secondary schools, all the 6 geopolitical zones. This is a very important topic to us at the Victim Support Fund. On the 30th of March, very quick background, I'm going to try to be brief. On the 30th of March, General T.Y. Danjuma, who's the chairman of the Victim Support Fund, inaugurated a 6-man COVID-19 task force for the Victim Support Fund with a preliminary $1 billion funding to cover food, medical items, personal protective equipment, and risk communication, information dissemination across the Northeast, which is the primary constituency of the VSF. If you've been following our work for 6 years, you'd find that perhaps aside from the United Nations agencies, the VSF is the only organization that has rebuilt schools, rebuilt hospitals, partnered with teaching hospitals to be able to provide prenatal and postnatal care for women, done WASH projects across the entire region. So we began with 1 billion on the 14th of April in Malaysia Gardens IDP camp in Abuja. And then from Abuja, of the 1 billion, 20% went to Abuja, 20% to Borno, 20% to Lagos, and then 10% to Yobe, 10% to Ogun, 10% to Adamawa, and 10% to Taraba. At the VSF, data is very important. We run an extremely data-driven, robust data-driven monitoring and evaluation system. So the reason I'm giving you numbers is so that you can sit down and do the math by yourself. I like what the gentleman from Datafy talked about in terms of the cost of items, because those are some of the possible loopholes where corruption finds its way into emergency intervention. So the first thing we did after General Danjuma inaugurated our task force was to set up a secretariat that was, headed by the director of programs of the VSF and also populated with our procurement officer, our head of admin, our head of monitoring and evaluation, and our head of research. And because we didn't simply want to throw money at problems, what we did was to begin to create a needs assessment with the understanding that what the problems in Borno would be are not the same as the problems in Lagos or the problems in Ogun. And Lagos and Ogun were frontline locations because Lagos, Ogun, and Abuja were the 3 major locations where the federal government had declared the lockdown. And we understood that it'd be difficult for the government to implement the lockdown strategy if people were hungry and had to go out, to find food. So we broke down those resources and then started to donate the food items and the PPEs to the different states. I wanted to mention that aside from food, PPEs, medicaments, which we broke down into primary care and secondary care. Under primary care, we gave out basic multivitamins and analgesics. Under secondary care, we gave out anti-hypertension and anti-diabetes, in addition to electronic sphygmanometers and anti-diabetes, diabetes checking monitoring equipment. And so from Abuja on the 14th, we moved on to Borno, from Borno to Yobe, Yobe to Adamawa, Adamawa to Taraba, Taraba to Lagos, Lagos to Ogun. And that marked the preliminary $1 billion intervention of the VSF. After which the chairman then said we should proceed to phase 2, which covered the South-South and the Southeast, and then completed the Southwest. So phase 2 was 882 million naira, covering Edo State, Ebonyi State, Enugu State, Delta State, and Ekiti State. And in addition to that, you may have heard of the National Pandemic Response Action Plan of the federal government that was funded by the VSF in partnership with the World Health Organization. We also provided ICT equipment for the COVID-19 Secretariat of the Victim Support of the Federal Ministry of Health. And if you also go through the NCDC handle, or if you do some Google search, you'd find that we donated telesurveillance and conferencing equipment to the Nigerian Center for Disease Control, because at the time during the lockdown it was difficult for their staff to travel and they needed to do data monitoring and collection and gathering from across the country. So we donated that equipment to them. And we only just completed the 3rd phase of these interventions last week, covering the North Central and the Northwest, specifically beginning from Benue to Niger, Niger to Plateau, Plateau to Kano, Kano to Katsina, Katsina to Kaduna, and then Kaduna to Zamfara State. So far we've done 19 states, not 14 as you mentioned. And part of the third phase of our intervention is to move on from donating actual food items and PPEs and medicaments to more enduring sustainable interventions like WASH projects. So we're donating to support the gradual reopening of secondary schools nationwide. We're donating solar-powered boreholes to 54 secondary schools across 18 different states in all the 6 geopolitical zones of Nigeria. The third phase intervention is 1.5 billion. And one of the interesting things that we did differently at the VSF was to set up a price intelligence team that made sure that whatever it is we were buying and procuring for the Victim Support Fund COVID-19 intervention was, you could benchmark them against market price. So, for example, we didn't, in phase 1 and 2, it was slightly difficult because commodity prices were very high. That also explains the break we took between June, July, where we did phase 2, and, October, November, December, when we started phase 3, because the commodity prices were very high. Traveling was extremely difficult. There were a lot of bureaucratic bottlenecks around engaging government and even getting local NGO partners and community-based organizations on the ground, because we partnered with them across all the different states to ensure that there was a clear, transparent and monitoring, process in our distribution. So we split all the items we bought into 2 and gave 50% to the government and gave 50% to our local NGO partners. And if you simply go to the VSF website or our social media pages, or if you even follow me on social media, you'd see how granular the information is. So our vegetable oil, for example, we bought Grand Oil for the entire intervention. And if you go into Daleko markets in Mushi, in Lagos, or if you go into Sabongeri in Kano, or if you go into Harare markets in the east, you'd find that the prices we bought these items are actually cheaper than what they are bought in the markets, because we eliminated the contractors, removed the middlemen, and bought directly. We did direct procurement so that we could increase the quantities of the items we were procuring more than phase 1 and 2, and also eliminate the percentages we're supposed to be giving contractors. And so those monies went directly to the manufacturing companies, and then we got the commodities at much more lower prices. So we bought the rice, we bought the vegetable oil. If you look at the quantity of the beans, the salt, salt was bought at Dangote Salt benchmark, standard market price. And these are information that we're willing to share, with the Follow the Money team. One of the things that we saw on the ground that was extremely depressing for us at the VSF was the level of endemic poverty in the country, and perhaps the ugly underbelly of the lack of preparedness of Nigeria when it comes to epidemics and emergency situations like one that the COVID-19 situation presented. I went to, as chairperson, I went to Malkohi IDP camp in Adamawa state, and I realized that all of the information that was being shared about COVID-19 preventive measures were in English language. Not a lot of people in those parts of the country, especially high density population environments like IDP camps, schools were already shut down, but a lot of the preventive measures were in English language. So we went back to the drawing board, and I sat with my colleague Al-Kasim, who heads our media team for VSF, and started to craft local messaging in Kanuri, in Fulfulde, in Pidgin English, in Yoruba, in Hausa, in Igbo, and started to share the flyers across the country. But beyond that, we realized that a lot of people also speak their languages but don't read their languages. So what the VSF began to do was to also go on radio and put this information about wash your hands constantly under running water, ensure you monitor, you maintain social distancing. But those were not the reality. Social distancing is not the reality of an average Nigerian IDP in an IDP camp in Mongono or in Dalori or in Jetete or in somewhere in Gombe or somewhere in Adamawa and all of that. So one of the things we did was buy over 300,000 pieces of tablet soap and started to donate them to those high density environments so that people could wash their hands. And we saw poverty firsthand. Like my dear sister.
All right, I think your network is getting poor.
But like Osasu said, it was extremely heartbreaking to see palliatives months after the
All right, so
lockdown
why we
was
try
over.
to fix that, why I give her much time to talk was so that we can relate with what is happening on ground. And number two, so that a government can see systems working in trying to solve the issue at hand. And what is the issue? Accountability and transparency. Contracting.
Lucy, I didn't mean to cut you short, but sorry, Lucy, I just wanted to say that if people have the will and the courage and the dedication to coordinate humanitarian support for the poor with integrity, it is possible in Nigeria. That it is possible if you give the right people the level of responsibility and autonomy they need. You don't need to follow people around. Your conscience should naturally call you to action when you walk into a community and you see people so poor, and you know that the 10 kg bag of rice and beans that you have given them is not going to last them more than a few weeks. Let me also say this, at the VSF, we were not even just passionate about donating palliatives. We prioritize the dignity and the nutritional well-being of our beneficiaries. We had a standard profiling of the people, of our intended beneficiaries. What is their economic status? What kind of homes do they live? Do they have jobs? What is their age? What local governments do they belong to? So for example, in Lagos, we didn't give food to environments where you have a high density of rich people, because we know those rich people should take care of the poor people in their communities. We went to communities like Agege, Amuwo, Odofi. In Enugu, we went to very poor local governments. In Edo State, we went to Ohogwa IDP camp, where there are more than 3,000 children and women who relocated from Borno and went to settle in those IDP camps. So we didn't simply want to give 1 kg, 2 kg food. We gave 10 kg because we wanted it to be sustainable over a period of time and last them while the lockdown was on. We also prioritized the combination of carbohydrate, protein, fats, and oil, because nutrition was also important in the middle of a pandemic where you have the immunity of poor people of our country at the lowest of the lowest. So these are things that we believe at the VSF. If you want the data, if you ask me as chairperson, or if you ask anybody at the VSF, who received your food items in a local government in Zamfara, we will give you their names. We collected the data. We have their phone numbers. We have their local governments. For all the NGOs we partnered with for the distribution, we signed memorandum of understanding with them and gave them a clear mandate about where they should distribute the items to, fulfilling the mandate of the Victim Support Fund COVID-19 Task Force in a way that is exemplary along the lines of transparency, financial probity, and accountability. Because when you talk about accountability, it's not just about stealing money. It's not just about the money, the 1 billion naira being stolen. You can still give food to people and they will still share it with their family members, and it will not reach the poor people you intend that it should reach. All right, so those are some of the key things, a data-driven monitoring and evaluation system that is end-to-end. Let me close with this. For our wash projects, our borrow facilities that we're donating around the country, we chose states where we had not done any preliminary intervention. And I'm very proud to say that by the end of December 2020, the Victim Support Fund would have done a 3.3 billion naira intervention that would have touched 30 out of 36 states of this country. Each state is receiving 3 boreholes across 3 senatorial districts, along with each school receiving 2,000 face masks for their teachers and their students, in addition to disinfectants, Jik, Dettol soap, hand washing liquid. Each school receives 4 pieces of automated hand washing foot pedal machines. So we're not just giving them boreholes, we're ensuring that people actually do wash their hands. If people are willing to engage me after this to ask me any more questions, please feel free to ask any question at all. Around the money, who received the items, who we gave them to, the VSF will answer your questions. Thank you very much, Lucy, and thank you to everyone listening.
Thank you so much. I think you've answered our last question for all the panelists. So we are trying to wrap up the session. So in 1 second, please, can everyone give us suggestions? What can government do correctly? What can government do rightly? You know, I thank God that ICPC is here, but although they didn't want to appear on the panel, but what message are we sending to the government? What do we want government to do differently? What do we want government to, how prepared should the government be for, you know, future emergencies like this? How transparent, what systems do we want government to put in place to track, so that citizens can track, so that people in the communities can track, so that the grassroots people that cannot speak for themselves, can also track and see what government is bringing to them and interventions that are coming to them?
Okay.
Sorry, can I start?
Ladies first.
Okay, just number one, the government needs to not wait for somebody to file for information. They need to make it readily available, put it out, let people know that if I'm looking for this information about funds or whatever, I already know where to go and find it, and it's available for me with ease without any bureaucratic issues. Then second, the government should partner with organizations like Code. Why? Because they are doing the work, they are very qualified, and they've been showing results. So the government needs to make sure that these organizations such as Budget and Code that are already doing these things, how can they support us? How can we partner with them to make sure that this thing is done at the scale that it's needed? So those are my contributions.
Okay. For me, I would say OGP is very, very important. So we're trying to preach open government, and open government gives an open environment for government and citizens to co-create. Now we have the federal signing up to OGP, right? Now, but then we still have issues with Nokopo. Nokopo is a platform where the procurement data is meant to be housed. However, those informations are not there. So that with that information, it gives you an idea of emergency procurement, it gives you an idea of the bill of quantity, it gives you an idea of what government plans to spend, how they want to spend it. Even the contractor himself or ourselves is going to implement that project, so that people at the grassroots can hold the contractor accountable. So it starts from there. Once the citizens are aware that, oh, this particular bowl, this is the type of bowl you are, the machine you are buying, this is the type of school they have approved that you should build, then citizens can start demanding. It can start from even the smallest of the things, like the cement blocks. Maybe on the procurement details, maybe it was written there that it should be 9 inches. Because they have no idea, the contractor might decide to use 7-inch block. And then, so once they have this information, it is easier for citizens to hold the contractor accountable, giving feedback also to the government to say, oh, we noticed that there's somebody in our community, these are pictures. So there's a feedback mechanism between citizen and the government. And one thing the open government would definitely erase is that doubt. There's a disconnect, like she said earlier, and OGP would help to bridge that doubt gap, whereby citizens can then begin to trust the government.
And not just signing on to the OGP, actually implementing the OGP.
That's another point, actually. Yeah, but then, like I said earlier, we signed on to OGP. The Nokopo platform is still there, not even moved an inch from where it was before signing.
Thank you once again. Yes, as pertinent as it is to prefer solutions to the government, we as citizens, I believe, actually need to start to brainstorm ways we can hold government accountable. For those of us in the media, as the defenders of our democracy, as the fourth realm of the estate, we also need to Sorosoke. We need to ginger. We need to do more. We've seen the collective power of the people with the NSAS process. And I keep on referring to that because that gives you empirical evidence of what we can achieve when we come together as a collective group to demand accountability, to demand transparency of the government. Imagine we're more organized. Imagine we come together and say, okay, Mr. Governor, Mr. Councillor, Mrs. Chairman, Mrs. Vice President, Mr. President, give us a proper breakdown of how XYZ funds are appropriated and, expended. And we would be able to get these results that we're demanding for. So as much as we want to prefer solutions to government, we have to realize our power as a collective. We need to realize our power as citizens of this nation to demand and actually get the results of those things that we're demanding for. So for those of us in the media, we need to do more. For those of you sitting down here today, in the CSO sector, you need to do more. Every one of us can do more. We can amplify our voices for the collective good of our nation.
Thank you so much, Chief, for taking us to NSAS process. I didn't want to go there, but thank God you went there. All right, so we go to a virtual panels. Your recommendations in 1 minute, please, for the government and maybe for the citizens, what citizens can do to hold the government to account.
Should I go first?
Yes, so can we unmute them? We can start with Data Fight, please.
Okay, hello? Hello, can you hear me?
Yes, I can hear you.
Okay, so I quickly want to say this before I quickly move into what I want to say. I am aware that ICPC is there, but probably they don't want to be on the panel. But I just want to appreciate what they did, tracking or probably checking how the Federal Ministry of Education through Unity Schools embark certain amount of money for why there was lockdown, why Unity schools were being shut down, but Unity Schools officials still had to earmark certain amount of money to keep students on meal subsidy. I want to appreciate CPC for that, and that will propel me into recommendation. I think nice. Okay, so I feel they still need to do more. They need to I know they use the
Sorry, your mic is breaking. Is it from him? It's from him?
There are two different.
Oh, but I think your mic is not. Okay, we can stop Mr. Your
some person's mics were.
All right, so Ms. Torres, please can you give us in 1 minute, we are really big time, your recommendations, government and citizens.
So I'm just going to say that. Lucy, can you hear me?
Yes, I can hear you.
Okay. I just wanted to say to the government that it's actually in the best interest of the government to do things in a very transparent way. Honestly, government will get more money from citizens if they were more transparent. You wouldn't need to chase me to pay my taxes if I'm convinced that you are using my taxes to provide amenities that are useful for me, my family, and my community. You wouldn't need to pursue me around as a citizen to play my part. If I had a recommendation for the government around coordinating humanitarian support for the poor, I would say that you need a private sector, you need a dedicated private sector level intervention that is strictly private sector. From the point of the donations to the point of the implementation to monitoring and evaluation to reporting. You need people who've made their own money, who therefore would not come into the system and see it as an opportunity to enrich themselves. Rather, they'd see it as an opportunity to serve the country and give back. I'll advocate for, I definitely don't agree that, and it's not just exclusive to Nigeria. I mean, the day before yesterday, I think it was in, I don't recall the country now, but a senior government official was indicted for, getting involved in corruption around COVID-19 intervention. So it's not a thing that is unique to Nigeria. However, I think that interventions around social welfare and social protection, especially for developing countries that don't have systems and structures in place to ensure that things, work out the way they should, we may want to depend more on the expertise, on the high-level expertise of, private sector practitioners who've done this work extensively and understand the risk, the reputational risk that come to them if they lose credibility in the face of implementing projects like this one. And that will be my singular, recommendation to the Nigerian government, that you want to be able to hand this over to competent people who have a proven level of integrity and dedication to social protectionist policies,
who understand the legal frameworks and regimes and the possible consequences to themselves and their businesses when they do things wrong. You don't want to single-handedly hand over billions of naira to people in government without any sort of checks and balances. You are simply going to create loopholes for all sorts of shenanigans. That would be my submission. Thank you very much.
Thank you so much, Mr. Yossi. So I think, is there a need to go back to data fight?
Yeah, if there is.
All right, please your recommendation in 1 minute.
Okay. So quickly, I think it's high time the federal government harmonize their portals, their open portals. Government should try as much as possible to harmonize the NOCOPO, the OTP portals together so that and sensitize citizens on the essence of that portal. Also, the Office of the Accountant General and other MDAs should stop blame games and take responsibilities for whatever things and whatever activities that is being done within their purview. So also, I also think media and civil society also needs to leverage on data. We need to leverage on the OTP, we need to leverage on the NOCOPO portal so that we'll be able to sensitize citizens on what is next to do from our office. I also want to quickly say that if the government is sincere enough, I think they should, from what Mr. Toyosi has outlined here this afternoon, I think government should rather look into their model, the model of VSF, and we'll have a better society from there. Thank you.
All right, thank you so much for your contribution. Okay, so we come to the end of this panel, but in my closing remarks, I'll say that the citizen, you and I, occupy the highest office in this federation because it's our country. And for every leader that we have, we expect nothing but accountability and transparency on how they're using our funds and how public funds are being utilized. So I will say that it's high time our government takes initiative, move a little bit higher into making systems to work for everyone, into ensuring that even the poorest of the poor in the marginalized, hard to reach communities, of course, which is our goal as Follow the Money, is to ensure that citizens, the marginalized ones, can access information to hold their government to account. So I want to also charge citizens to take that step. Sorosaki, take that step, speak out. So you can join us on I Follow the Money, www.ifollowthemoney.org. You can also find more information on the tracker NG, and you could also go on NOCOPO to find out more about how to hold your government to account. Please, ladies and gentlemen, help me to put your hands together for this wonderful panelists, distinguished panelists that we had. Thank you so much for your time, Chief Osazu. Thank you so much, Mr. Tolu and Ms. And for our virtual panelists, Mr. Toyosi, thank you so much for joining us. And our colleague from DataFi, thank you for your time. Do have a pleasant day. Thank you.
Thank you very much, Lucy. Have a good afternoon.
Thank you, our moderator, for leading this session. We're coming to the end of this very important town hall meeting. Toyosi, I thought I was going to see you in person. I was looking forward to having lunch with you so we can continue our conversation from the last time in Akwa Ibom. Thank you, the guy from Data Fights. My regards to your boss, the founder. Thank you, my good friend, Chief Osasu Igbenidium. She has always stood by my side. Thank you for moving your flights from yesterday and hoping to catch your flight in a couple of hours. Thank you, Mimi Loshi and Oxfam for always supporting our work. Thank you, our participants, over 700 of you who are joining us virtually. Thank you to our partners who are here from government, ICPC, and other collaborators. Sheon and I have a 10-year plan on fiscal accountability, and two of us have dedicated our time to ensuring that this 10-year plan could inform our legacy in fiscal transparency and accountability in Africa. We're hoping that as we transition from the civil society space This plan would allow for younger activists and campaigners and data enthusiasts to lead the work that we have laid foundation on. We're hoping that from the outcome of this meeting, we would continue to engage government stakeholders. But let's not forget that COVID-19 is still here. Before COVID-19, we had over 80 million poor people. During COVID-19, we had 120 million poor people when you look at data. During COVID-19, we had over 50% of people lost their jobs. So what this also tells you is that there's a lot of pressure economically, socially, culturally. So there's a fight that we must face. And as citizens, I believe that without our accountability mechanism, government would not act. So it beckons on us to continue to hold government to account. But as we hold them to account, we also need to support them, because I've met government officials who want to actually get the work done. So they need young people with the ideas, with the energy, to not only Sorosoke, but bring their intellectual know-how in providing solutions. Thank you, guys. Let's have a wonderful day. And as Connected Development, we'll be reaching out to you on some of our next steps, and have fun. Bye-bye now.
Projects in rural communities across the continent. Unfortunately, most of these funds never get to these communities. In most cases, community members are not aware of such funds, and even if they are, they lack the will or capacity to challenge those in authority and ask them questions. At ifollowthemoney.org, we offer people in these communities a platform to obtain information, interact, and mobilize them to demand accountability, thereby ensuring that these funds are used to provide the facilities they are meant for. So, join the movement. Join us today at www.ifollowthemoney.org. Follow the money, making no loss.
Welcome to the 2019 UN SDG Action Award.
We have showed that mobilizing